So at NextStepCare, we enable providers and existing healthcare infrastructures to increase the efficiencies within their systems. We do this by leveraging the patient's smartphone through a series of multiple modes of AI and multiple phases of AI. Ultimately, we're improving patient outcomes, utilizing the patient's smartphone and existing resources. So the problem we're trying to solve is that we currently depend on the patient to determine that there's something wrong enough to come in. This can lead to tissue loss, limb loss, and ultimately death in certain populations. What we're trying to do is transform the medical system from treatment to prevention. I'm a practicing foot and ankle surgeon, and I perform limb salvage on patients throughout the United States, mainly in the diabetic population. One of my patients ultimately came to me about 2 weeks too late, and instead of performing a simple debridement or minor procedure with some antibiotics, we ultimately had to perform what we call a transmetatarsal amputation, where we resected half of his foot. The best possible outcome for him was that healed, and he can go back to being a farmer. Ultimately, he did heal, but time was lost, and I'm trying to prevent loss like that on a mass scale. Really what I'm most excited about is how quickly we're going to be able to help people. In countries where patients have a smartphone, and the patients do predominantly speak English, we view that as an opportunity to help the providers that are already in place. As a foot and ankle surgeon, I know how hard it is to practice in today's day and age. The squeeze on us from overhead to compliance, just to keeping your board certification, in the face of cuts from Medicare, it's a very difficult situation. What we're trying to do is give back that freedom to providers. We want to allow them to practice the way that they wanted to, but also give the patients what they're requesting. I'm hoping at this Seed to Table event, I'm going to be able to speak with investors who are going to be able to facilitate us reaching our next level. We are hoping to get into at least 15 to 20 enterprise hospitals, not just a single hospital, but hospital systems, as well as onboarding approximately 500 providers. To reduce the burnout on the existing resources is the goal of our company. Nobody signed up to see 60 patients a day and barely make ends meet. At NextStepCare, we aim to give providers the lifestyle that they signed up for.